Welcome, everyone. Thank you for joining us. My name's Beth Kelsey. I'm a women's health nurse practitioner, and I'm editor-in-chief for Women's Healthcare, a clinical journal for NPs. I'll be serving as the moderator for today's event. Our topic today is the need for woman-controlled contraceptive methods for dual protection, with presentations from two healthcare professionals. Our first presenter is Margaret Shamish McCann. Margaret, or Maggie, is a women's health nurse practitioner and a lecturer in women's health in the nurse practitioner program at the University of Pennsylvania School of Nursing. Our second presenter is Cheryl A. Ross, MD, known as Dr. Sherry. Dr. Sherry is an award-winning OBGYN, author, entrepreneur, and women's health expert. Over the course of her 25-plus years of practice, Dr. Sherry has received the Patient's Choice Award for Compassionate Doctor Recognition for 5 years running, and the Patient's Choice Award for Best OBGYN for 6 years running. This educational program is brought to you by FC2 Female Condom, the only woman-controlled dual protection method. FC2 is a division of Veru Incorporated. Brian Grosch, who is the Chief Commercial Officer of Veru Healthcare, is also joining us today, and he'll speak briefly with us after the two presentations. Our agenda for today then will be 1, what is FC2? 2, how to use FC2. 3, why FC2? 4, talking with patients about FC2. And 5, FC2 and prescription. I want to welcome Maggie, Dr. Sherry, and Brian, and to thank them for their time. So now I'd like to welcome our first presenter, Margaret Shamish McCann, or Maggie. Maggie is a women's health nurse practitioner, and she is a lecturer for the Women's Health Nurse Practitioner Program at the University of Pennsylvania School of Nursing. Welcome, Maggie.
Hello, I'm Maggie McCann. Today I'm going to talk to you a little bit about the benefits of the female condom, FC2. The FC2 is a great addition to our toolkit for helping our patients reduce their risk of STIs, including HIV and unplanned pregnancy. It is currently the only woman-controlled method with this dual protection and the only FDA-approved vaginal condom. It has the benefits of being latex-free and non-hormonal. It is made of nitrile, which is 3 times stronger than latex and much less likely than latex to cause allergic reactions. It comes coated with a silicone-based lubricant on the inner and outer surfaces of the condom and can be used with additional water and oil-based lubricants as well. A woman can insert the FC2 seconds, minutes, or up to 2 hours before having sex so that she knows she'll be protected and ready. It contains no spermicidal additives, and it is preservative, paraben, and gluten-free. The female condom is easy to use, especially once you've had a little bit of practice. You want to first open the packet, locate the arrow, and carefully tear down the side of the package. Make sure you don't scratch the condom with your fingernails or use anything sharp to open that package. You will hold the inner ring, which you'll know it's the inner ring because it's coated with nitrile at the end. You squeeze that ring and just gently insert it into your vagina. Push it all the way in so that it's up behind your pubic bone and as far into the vagina as your fingers will reach. Try to make sure that it's not twisted. The outer ring should remain outside of your vagina. And then when you're ready to start having sex, just gently hold that outside ring as your partner's penis goes into your vagina to make sure that the outside ring doesn't get pushed inside the vagina with the penis. You also want to make sure that the penis doesn't go on one side or the other of the condom, but that it's all the way inside so that you and your partner are both protected. After sex, just gently grasp that outside ring and twist it to seal any semen inside the condom, and then gently pull it out and dispose of the condom in the trash. Make sure you don't flush it. And that's pretty much it. Simple, easy, and effective contraception and STI prevention.
Thanks, Maggie. Now, for our second presenter, Cheryl A. Ross, MD, also known as Dr. Sherry. She is an award-winning OBGYN, entrepreneur, author, and women's health expert. Dr. Sherry has been practicing OBGYN for 25 years in Santa Monica, California. The Hollywood Reporter named her as one of the best doctors in Los Angeles. Castle Connolly named her as a top doctor and exceptional woman in the specialty of obstetrics and gynecology, and she was selected as a 2017-2018 Southern California Super Doctor. She's the author of the book Sheology, The Definitive Guide to Women's Intimate Health, period, and co-founder of Cycle, the first of its kind wellness brand for women by women based on the 7 distinct and individualized cycles women experience in their lives. Dr. Sherry's mission is to change the narrative of how women talk and learn about their intimate health and overall well-being. You can follow her on Twitter at Dr. Cheryl Ross. Welcome, Dr. Sherry.
I'd first like to do a brief overview on sexually transmitted infections, which are really formerly known as sexually transmitted diseases, and they're often used interchangeably. Now, aside from the common cold and flu, STIs are the most contagious diseases in the United States. The most common cast of characters include chlamydia, gonorrhea, herpes, HPV, HIV, syphilis, trichomonas, and hepatitis. It's also important to mention HPV because it is epidemic in the United States, affecting over 79 million women and men. Now, the Zika virus is the new kid on the block in this category when speaking about STIs, and we don't often know that association, but I will speak more about it later. It's interesting to know that women of all ages, from teens to women in their 70s, are at risk for STIs. Now, it may be shocking to know that single women 50 to 59 is the new high-risk group prone to STIs. And this was the newly sexually active women who have been recently separated, divorced, or widowed, and they're just getting out into the dating world. The notion of having their partner wear a condom or even having be screened for STIs is really not happening enough. So this is a very important group that really need to know about prevention of STIs. Safe sex, what is the definition? Everyone is confused on that, and we will speak further on safe sex. And really the best offense is a good defense. Male and female condoms are really going to be your best bet in preventing STIs. So what does safe sex really mean? I find that most of my patients are completely confused about this definition. And sadly, condoms are not consistently used with newly sexually active couples. So really, it doesn't come as a complete surprise to me when HPV, chlamydia, gonorrhea are found on routine cultures and pap smears. So let's talk about safe sex. What is the definition? Safe sex means using condoms during vaginal or anal intercourse and oral sex. Safe sex during oral sex with women means using dental dams over the clitoris. And safe sex during oral sex with men means having men wear condoms. Both of these strategies will protect the throat from HPV. Now, what's exciting is FC2 is a woman's way of ensuring she is having safe sex at all times. FC2 is the absolute best way to prevent STIs from spreading. Let's talk about what I refer to as the trifecta of STIs. Chlamydia, gonorrhea, and syphilis are the 3 most commonly reported conditions in the nation and have reached a record high level. In 2015, the CDC presented the annual STI surveillance report showing that these 3 STIs have reached the highest number ever. Now, all 3 of these STIs have increased in occurrences from 6 to 19% in 2015, and this is a very scary statistic. These three most common STIs have reached epidemic levels, costing the healthcare system $16 billion annually. Now, Dr. Jonathan Marin, who's the director of the CDC's National Center for HIV/AIDS, viral hepatitis, STI, and TB prevention, says STI prevention resources across the nation are stretched thin, and we're beginning to see people slip through the public health safety net. Turning the STI epidemics around requires bolstering prevention efforts and addressing new challenges. But the payoff is substantial in terms of improving health, reducing disparities, and saving billions of dollars. It's crystal clear from the 2015 reports that the cost of STIs are at epidemic levels. Now, some other interesting statistics include Americans aged 15 to 24 accounted for nearly 2/3 of chlamydia diagnosis and half of gonorrhea diagnosis. Men who have sex with men accounted for the majority of new gonorrhea and primary and secondary syphilis cases, amounting for 82% of male cases with known gender of sex partner. We are also seeing more antibiotic-resistant gonorrhea in men who have sex with the men group. Women's rate of syphilis diagnosis increased by more than 27% from 2014 to 2015. We're seeing more reported congenital syphilis, which occurs when the infection is transmitted from a pregnant woman to her baby, increased by 6%. When it comes to primary and secondary syphilis infections, women only account for less than 10% of new infections. Now, in my practice, I see newly diagnosed cases of HPV every day. As I mentioned earlier, over 79 million women and men currently have HPV, with 14 million more contracting this virus each year. HPV is the most common sexually transmitted infection, affecting 80% of men and 90% of women. Women and men with HPV can have genital warts, precancer, and cancer of the cervix, penis, anus, head, neck, and throat. The current HPV vaccine has a very safe track record and can reduce your risk of developing these types of cancers by 90%. To lower your risk of HPV, you must get vaccinated. The hope is girls and boys get the vaccine before they become sexually active. The ideal age to get the HPV vaccine is going to be around 11 to 12. HPV is often found on an abnormal pap smear, and the majority of women are shocked when they are told this common virus was found living in their cervix. Many women have already received the HPV vaccine, which causes more frustration and anguish when they get this type of news by the gynecologist. One of the problems with this particular STI is most people are unaware that they carry HPV, especially men. Unfortunately, men do not have an equivalent to a pap smear, which allows detection of HPV for women. Unless men have warts or a history of warts, they have no way of detecting this epidemic virus. The male condom does not provide complete protection against HPV, since the virus may live at the base of the penis or in other exposed areas, thereby allowing it to easily pass to women during sexual intercourse. So who's really at risk for HPV? These are women and men with multiple sex partners, smoking, poor diet, and certain medications that lower your immune system. HPV, like viruses, can live dormant in the body for years and years. Now, one of the best ways to avoid HPV is using condoms. The FC2 condom for women definitely protects the spread of HPV during sexual intercourse. The Zika virus is spread through a mosquito bite. It can be transmitted through sex with men and women, and Zika can easily be transmitted further to a baby if a woman is pregnant. The problem with Zika is most people don't even know they carry it because they may not have any symptoms. So for pregnant couples at risk for Zika, they must use condoms or not have sex for their entire pregnancy. The Zika virus can live in semen in men for up to 6 months after being exposed. Now, for babies affected by the Zika virus, the medical costs are exorbitant. Lifetime cost of care for microcephalic children affected by Zika is $1 million on a short-term basis and $10 million on a lifelong basis. As an example, if just 13,000 babies are born in the United States with the Zika virus, which luckily only accounts for 0.3% of all U.S. births, those babies and their associated disabilities to keep them alive and providing them with lifetime care could range from $13 billion to as much as $130 billion. So as you can see, prevention is so important for a number of reasons. The good news with Zika is there's no report of infants getting Zika through breastfeeding. Now, in regards to what the CDC and American College of OBGYN recommends for Zika virus protection is the following. Since the Zika virus can be transmitted through sex, a condom must be worn for 6 months if a male partner has been in high-risk areas where Zika has been found. Studies have consistently shown that the virus can be found in semen for 6 months. Pregnant women should be advised to consistently and correctly use condoms during sex for 6 months with their high-risk partner or abstain from sex for the duration of the pregnancy. The potential to pass this aggressive virus onto a growing baby has catastrophic implications. So what can women do to protect themselves from STIs? FC2 is a game changer to prevent women from getting STIs. The FC2 gives women the control to take charge of their reproductive health. FC2 provides protection from unintended pregnancy and sexually transmitted infections, including HIV and the Zika virus. The FC2 can be inserted hours before sex occurs, which eliminates that negotiation conversation with men. FC2 is the only female condom that is approved by the FDA. It's a hormone-free and latex-free condom, which is so helpful for those women with latex allergies. Another wonderful thing about the FC2 is it's covered with a $0 copay by most insurance plans when dispensed by a healthcare provider who can write you a prescription. Other benefits of the FC2 include those women using the FC2 are more likely to use protection during sex. When the FC2 female condoms were offered alongside male condoms, there were more protected sex acts. When there are more choices, there's more protected sex and less STI transmission. FC2 is effective. In FDA safety and efficacy studies, FC2 was found to be 95% effective as a barrier contraceptive. With over 20 years of independent safety, effectiveness, and acceptability research, other data is available showing an efficacy as high as 98%. FC2 saves money. A female condom program in Washington, D.C. prevented enough infections in its first year to save more than $8 million in future medical costs. Now let's talk a bit about long-acting reversible contraception, also known as LARC, which includes injections, intrauterine devices, also known as IUDs, and subdermal contraceptive implants. The American College of Obstetrics and Gynecology recommends that LARCs should be a first-line option for all women in reproductive age. Now, women in college are especially catching on to using LARCs and IUDs in particular as an easy solution for long-term birth control. Now, as great as LARCs are as a birth control method, they do not offer any STI prevention. And this is where the FC2 is perfect. It's also important to note that FC2 can be used with an IUD, and to know the IUD string will not interfere with FC2 insertion of use. I also want to mention a new way of HIV and STI prevention, and that is called PrEP, which stands for pre-exposure prophylaxis. Now, in 2012, the FDA introduced PrEP for HIV prevention, and now it's also being used to prevent some, but not all, STIs. Using FC2 with PrEP greatly increases your risk for reducing any exposure to HIV and STIs. Now, Cosmo ran this fantastic story about stealthing, which is a new concern for women in the bedroom. Stealthing is when your partner during sex will remove the condom that was originally put on at the beginning of sexual contact without you knowing. This increases your chance of getting an STI and getting pregnant. When a woman uses the FC2 and takes control of her own protection, women don't have to worry about irresponsible male partners. FC2 gives women the control to protect themselves from STIs and pregnancy at all times. Now, what is the best way to talk to patients about the FC2? Well, I like to go over just the facts on what a wonderful option this is to protect women in the bedroom. FC2 is a non-hormonal, latex-free device that offers dual protection against STIs and unplanned pregnancies. FC2 contains a silicone-based lubricant, but certainly you can use additional lubrication if needed. FC2 does not contain any spermicidal additives, preservatives, paraben, and is gluten-free. And often women suffer from allergic reactions from these types of ingredients when male condoms are used. FC2 can increase a woman's sense of empowerment as she is taking the initiative to protect herself and her partner. FC2 is an option for women who have difficulty or discomfort negotiating condom use during intercourse. Men do not have to maintain or have an erection in order to use FC2. And FC2 is covered by most insurance companies when given a prescription by a healthcare provider.
Thank you so much, Dr. Sherry. And now a few words from Brian Grosh. Mr. Grosh has served as Chief Commercial Officer of Veru Healthcare since January 2017. He served as Chief Commercial Officer of Telesta Therapeutics Incorporated, a biotechnology company, from October 2015 until December 2016, overseeing the commercial strategy, including the pre-launch and launch plan for the first immunotherapeutic for bladder cancer in 25 years. From 2014 until 2015, Mr. Grosh served as Vice President Market Access for Horizon Therapeutics Incorporated, a pharmaceutical company focused on rare diseases. Mr. Gross served as head of market access for Dendreon Corporation, a biotechnology company that developed and launched Provenge for metastatic prostate cancer from 2010 until 2013. Mr. Gross began his career at Merck & Company, where he rose through the sales and marketing ranks from 1989 to 2002 and was part of the product launches and promotion for Zocor, Prilosec, Plendil, Cozar, Hyzar, Trosopt, Fosamax, Maxalt, and Proscar, a drug to treat benign prostatic hyperplasia.
Thanks, Beth. I appreciate the introduction, and it's a pleasure to be with everyone today. One of the key aspects of increased utilization of FC2 is how the product is presented to the patient. And we know that as the product is presented to the patient, that practice makes perfect. So when it's presented, when patients have access to numerous condoms and they increase their utilization, it increases patient satisfaction. This was clearly outlined in the South African female condom distribution program. In 2015 and 2016, over 27 million female condoms were distributed through this program. And it was clear that with increased access and education, utilization went up. And really the purpose of the study was to gauge the progress of the female condom program. And it underscored the importance that as a healthcare provider, how you talk to the patient is of paramount importance. Some of the key results of the study: during the first month interview, 91% of the 598 women who had made use of the female condom, and the remaining number who had not used it cited reasons such as it was difficult to use and their patient or their partner refused to use it. So it was clear that how the product was presented, and if they were educated, had a major impact on utilization. In the last year, 66.7% of providers reported that they had never or rarely counseled or given FC2 to men. In the last month, 39% of providers discussed FC2 use in one-on-one interactions with female clients, compared to 61% who discussed male condom use. So again, that counseling and education on the importance of utilization and how to properly use the product is of paramount importance. 80% of women felt that using FC2 placed the woman in charge of their sexual health, and that's a very important aspect of the outcomes. At 1 month interview, most women, 87%, reported that their partners were supportive of using FC2, and at 6 months, this rose to 97%. Again, with increased utilization, there was a better response rate and an increased appreciation for the product. The level of unprotected sex, no male or female condom use, declined from 43.3% at baseline to 8.4% at 12 months. And one of the most interesting findings was that men were interviewed, and their first month, 58% had said that the female condom was either better or much better than the male condom. This increased, and by the 12-month interview, the percentage rose to 74%. So one of the largest condom programs in the world, female condom programs in the world, clearly outlines that with proper education and access to the product, that there is a better utilization or more utilization and a better appreciation for the product, not only for the female, but also for the male. So it's clear, and the data suggests this, the change starts with you, the healthcare provider. And the more education and the way the product is sold, and as you talk to the patient, increases patient acceptance and utilization. So prescribing FC2 has become very simplistic. Under the Affordable Care Act, insurance plans are required to cover FC2 with no or zero out-of-pocket costs, so it's free to the patient with commercial insurance. FC2 is the only option in the female condom category and is covered by most insurance with zero copay and zero out-of-pocket. You should be able to find FC2 listed in your electronic prescribing systems. All retail pharmacies have access to FC2. They're pharmacies including those listed below. So it is with every distributor throughout the country, and the product is in all major retail pharmacies. We also have an uninsured program, which is available at fc2.us.com. The product is not available over the counter, and when a patient goes in to see the pharmacist at a CVS, Walgreens, etc., they need to ensure that the pharmacist understands that the product should be in their system and they can order it to ensure that the prescription is filled. As previously noted, the product comes and is dispensed in single units of 12 condoms each, and most insurers will cover 2 of those units, and the provider can write for 11 refills. So in summary, FC2 is indicated for prevention of pregnancy, STI, HIV, and is the only women-controlled dual protection method available. FC2 is the only FDA-approved female condom. FC2 puts women in control of their contraception, and FC2 is 100% covered under the ACA as a contraceptive method.